I'm Dr. Jeff. So I'm going to show you exercises for spinal hygiene. It is really important to make sure your spine is flexible, to make sure it's lined up properly, and to make sure it's moving properly. Your discs do not have blood supply, and so the only way you can get water and nutrients is by having proper movement. Most people have spinal problems and issues. They have subluxation, so the spine has shifted out of place, and they have decreased disc space, and they have stress on their discs and their spine. So if we can get more motion in there, that can help rehydrate the discs, and that can increase your disc space. We see people all the time, as we start working on their spine and their posture, their disc space increases, so they actually get taller. So we're going to show you exercise for the neck, for the mid back, for the low back, to increase your motion and to increase your flexibility. So you want to bring your left knee to left shoulder. You want to hold this for 30 to 60 seconds. This is stretching glute max right in here. Go across like this. Hold that 30 to 60 seconds. This is knee to chest opposite side. This stretches the piriformis muscle. And then go across like this. This is called the pretzel. You want to have the upper left body going to the left and the lower body going to the right. This stretches the erector spinae right in here. So what we are trying to do is pull the shoulders back and pull the head back. So get in here in a doorway, lean forward like this, and I want you to hold this for 30 to 60 seconds. Most people get where their head goes forward, their shoulders are going forward, so this is going to counteract that. You can also do it in a corner like this. I call that the doorway stretch, the corner stretch. First one is to stretch the gastrocnemius muscle, keeping your heel on the ground and the back leg straight, and you're trying to get a nice stretch back in the calf. Here. Next one, you're going to keep your leg back like this. Now bend forward, trying to bring your knee to the ground and keeping your heel on the floor. Hold that for 30 to 60 seconds. That's stretching the soleus to stretch tibialis anterior. Put your foot up against a wall like this, lean forward into it, and try to go as much as you can. That's going to get a nice stretch in your calf. If your hip is feeling stiff or tight, I want you to get in here and do this 90-90 stretch. So get your front leg in here, 90 degrees, back leg at 90. Get as you're stretching this hip. Count of 5 to 10, relax, and go back, count of 5 to 10. And then you can also turn your body like this to stretch it as well. And hold that for a count of like 5 to 10 seconds, and repeat that 4 or 5 times. I'll show you a couple awesome ways to stretch your quads and lean backwards. You get a nice stretch in here, go to the point of discomfort and hold that for 30 to 60 seconds. If you bring your leg forward like this, that's going to stretch the psoas, which is right up here, and it gets really tight on us. So the first one is just a normal hurdler stretch. Get in here like this, lean forward. As you're stretching, rub the back of your leg. That will help activate that, and lean forward. Try not to get a bend in your leg. If you turn your leg out like this, that's going to get a nice stretch on the outer part of the leg. Turn it in. That's going to get a stretch on the inner adductor part. Hold that for 30 to 60 seconds each pose, and that's a good way to loosen up your hamstrings. What I like to do is called the bow forward like this. Keep your legs straight and just bend with your hips and hold that. I want to show you how you can use a lacrosse ball to really get rid of that pain and that tightness and stiffness in your neck. Up against the wall like this. That can really get in and break up those tight muscles. Now hold it for like 3 or 4 seconds in each spot, roll it around. An alternate way to do it, get in here and just lie on it, and that will really help break up the tight spots. I love the consistency of the lacrosse ball. It really helps. Now what I want to do is show you how to do repetitive cervical traction. This is going to help restore the curve in the neck. It's going to open up the space between the bones. Put your feet shoulder width apart, turn it slightly at a 45-degree angle, and you do little mini squats. So go down about a ½ inch to an inch, hold for a count of 1 to 2, and then go up, and then down. I like to use these TheraBands to help get more motion and just so we can passively stretch things. So to stretch in forward flexion, bend your head forward like this and hold this position for 30 to 60 seconds. To go back in extension, we don't use the band. Just push on the bottom part of your chin and hold that for 30 to 60 seconds. It's really important to breathe in while you're doing this. And we've got rotation. Grab your band, rotate your head right like this and hold that for 30 to 60 seconds. You're gonna get a nice stretch in here in the SCM and the scalenes. And the opposite side, hold that for 30 to 60 seconds. And then we've got lateral flexion like this, lateral flexion this way. That's how we stretch the neck for flexibility. Again, 30 to 60 seconds you wanna hold that for. Put your hands out like this and just swing all the way to the left, all the way to the right. The arms and hands will have to create momentum, and then you can bend to the left and bend to the right. Our goal is to help get as much motion in here as we can. This is exercises with an exercise ball. Rotate to the left, rotate to the right. We want to do this 50 or 60 times in each direction, and that will really help get more motion in the mid-back, low back area. And if we can get more motion, that's going to help the discs become healthier. Bobble chair is a great piece of equipment that's going to help get motion in the low back, and we want to get motion to restore the normal motion, normal alignment, and that's going to help increase the disc space. Like you're in a hula hoop, so put your hips all the way forward, all the way back. I want to do that 50 or 60 times going forward, 50 or 60 times going backwards. Once you do that motion, then do the same thing to the sides, all the way to the left, and then all the way to the right. Do that 50 or 60 times. The wobble motion, think of it like a figure eight. So you want to have the figure eight tipped on its side. Go left hip forward, left hip back. Right hip forward, right hip back. Now this motion simulates the normal walking cycle. So the left side of the body is going forward, the right is going back, and it kind of sways and pivots. As you do this, it's going to help to get everything working and firing right, and that will help increase the disc space. So when you go forward, I want you to breathe in. Breathe out when you go backwards. So again, right hip forward, right hip back, left hip forward, left hip back. So I'm going to show you some dynamic stretches. And a dynamic stretch is one where you're moving. And we do these to help increase the joint space between your bones. So start off at the calf and just shake your calf out like this. And try to do that for 30 seconds. Move up to the knee, forward and backward. Do that 15 or 20 times. Swings forward and backward like this. You can also go to the sides. This really helps open up the hips, and it's going to really warm you up here. Shoulder circles, so all the way forward like this, going counterclockwise, and then you can actually change it up and go clockwise. So you want to do these ATY exercises for 30 seconds to a minute, and that's going to really help get between the shoulder blades and in the neck. So I'm lying on a foam roller here. It is up and down. It's right in the small of my back. And I want you to do ATY. When you're doing it, try and extend your arms all the way. Extend all the way. I want to show you some things you can do to improve your proprioception, which is your balance and equilibrium. Patients that do this, they help to hold their adjustments for longer. Start off like this. Try to hold it for 30 seconds, a minute. If that's easy, then hold it like that. If you really want to get technical, close your eyes. Here we are using this disc ball to stand on here like this and try to hold that for as long as you can. I also have a rocker board. Stand on one leg. Try to hold that for as long as you can. You can go forward and backward. You can also stand sideways like this. This one I find a little bit easier. When you're standing on one leg, it's going to cause the muscles to fire on either side of your spine, and that will help get things firing better and in a better pattern. We're going to go over exercises for your core. The first one I want to show you is a high plank. Like you're doing a push-up, you want to have your torso parallel to the ground. I want to go for a minute, but if you're really good and really motivated, go for 2 minutes. This helps strengthen the core, hamstrings, the glutes, and the paraspinal muscles to support your spine. An alternative version, this is called a low plank. Try to hold this for 1 to 2 minutes, but we want to do this every day to help get more motion. Right now what we're gonna do is what's called a hollow hold. It's gonna make the stomach muscle stronger. In here like this, arms, legs out. Try to hold that for 30 seconds to a minute. That's gonna strengthen the abs in here. Reverse crunches. This works the top part of the abs here like this, knees to chest. Wanna work the lower abs, do leg raises like this. You can hold it 30 seconds or you can do leg raises. So doing all of these exercises is going to help make your core stronger, but you're less likely to have where the spine will go out of alignment. I want to show you some things that you can do to strengthen your back to be a lot stronger. This is Superman. So what you want to do is lift your arms and legs off the ground. You're going to do that for 20 or 30 seconds. If you don't like doing that, you can do repetitions. Up, down, like that. Do that 20 or 30 times. Another exercise we want to do to strengthen the low back muscles is dead bug. Like this, and you can hold that for 15 to 20 seconds, both sides, or you can do repetitions like this.